The hip is one of the largest joints in the body. It's critically important to your gait, the way you walk, the way you run and jump. One of the joints we take for granted every day. And there's an injury that often occurs, particularly in the athlete, and it's called a labral tear. The labrum is much like the pad inside the hip that helps the ball and socket to articulate, to move more smoothly and keep them separated, much like a meniscus in the knee. And sometimes when there's a lot of compression or a twist motion, that labrum, that little cartilage rim, can be torn. And then what do you see? You see pain in the front of the hip. You can see pain that radiates down into the thigh or even into the groin. And people will notice a pop or a click, a catching sensation on the inside. It's a poorly vascularized area, so they often don't heal well. And you can turn around and even years later, pain comes a little more frequently, a little more often, hurts a little bit more. How do you figure out what's wrong? You'll notice when we examine them that they'll have pain when you bring their hip up and compress it a little bit. And we'll often have to do an x-ray, but you know what it'll show? Probably nothing. Because usually the labrum can only be seen with an MRI. They put dye inside the hip to enhance the picture even more. Then what we'll do is often go under x-ray or ultrasound guidance, and we'll actually inject a little anesthetic inside the hip. And the patient will stand up and their pain's completely gone. Sadly, not for good, but at least it helps confirm the diagnosis. How do you repair it? Some people need surgical repair. It has to be tacked down or sewn down, but that's uncommon that they have to do that. If it's too large, it may need to be sewn or trimmed. Instead, you could put platelets in it, concentrated platelets, that help the labrum to heal and reattach. And also you could put stem cells in it, where we take stem cells out of the pelvic bone, super concentrate them, and inject them precisely on the labral tear under x-ray and a combined ultrasound guidance with a small amount of dye to confirm we're in the right spot. Then the platelets and the stem cells are dripped on that exact location. Put them on crutches for a day or so just to take some pressure off, and then give it a little bit of time, and then it can often heal.